Well, good morning. I'm delighted to be here and welcome. I'm here at GW, and this is my building, so it's a pleasure to walk downstairs to see you. I think I had that close, I was most near. So I'm delighted to be here. I'm going to tell you all you need to know about evaluation in 10 minutes. I just have to summarize, a worldwide profession. And so just to set the stage, program evaluation is typically thought of as applying social science techniques to measure stuff about programs and policies. But I would suggest that, in fact, it's way more than that. There's a whole evaluative thinking is probably the singular most important skill about evaluation. It's like critical thinking, but thinking in terms of how do you analyze programs and policies so that it makes sense. A lot of times people talk about, and particularly internationally, about monitoring or domestically performance measurement. And that, I would say, is, and that's the theory part, it's a part of the whole evaluation approach. But in fact, because of the way it's particularly treated in the United States, because of the Government Performance and Results Act and then the monetization of that, there's requirements of measurement of programs across the federal government, and it's sort of overwhelming in terms of the resources that it takes. The key point, I think, also is to remember is that, yes, we use all those scientific skills for measurement, but there's also a lot of judgment that goes in. This is the ability to figure out what to do and what it means when you get some data or findings is way more, demands way more than just, it's like reading my bank account, whatever. But there's a lot of interpretation. In terms of, as I said, in terms of using evaluation, since I have a very short period of time, I thought, okay, what are the three most important things I want you to take away, okay? So the three most important things I want you to take away, that we've gotten more and more sophisticated about thinking about the theory of change underlying what we are trying to accomplish and how we analyze that and use it. So I'm going to talk just a bit about articulating theory of change, framing appropriate questions, and again, it's way easier for me to teach somebody regression than it is to help people develop the ability to frame useful questions about programs and policies. And then lastly, what's extremely important is to figure out, well, how do you match the methods to the kind of questions you have? So those are the three most important takeaways. In terms of thinking about a theory of change, the point is that we think about, but what is it we do? What are we trying to accomplish? And what do we need to get from what we do to the more longer term outcomes? What are the assumptions we're making about the way people will react or not react, for example? What might be some barriers in the context? What are some support factors in the context that we're operating? What do we need? And so the point is that we go from the program elements to outcomes, but the point, things happen. Moderators, things happen. You have floods, you have hurricanes, you have outbreak of war, things happen that moderate and may affect the trajectory of what you're trying to accomplish. You also have things on the ground, contextual mediating factors. You might need to have things work and they aren't there, or they may be there and you hadn't anticipated it. So the point is you need to really think about how do we get from here to there, and particularly when you're dealing not only with the built environment, but the natural environment. As you know, it's extremely complex. For example, in a theory of change about training, when we train, we have all kinds of training programs, maybe university, maybe not. So the idea is that you give people new skills, they're going to be able to use it, but what we know is that what I call mediating factors are, first of all, that psychology shows that people that are higher in self-efficacy and higher in self-confidence are more likely to take what they learned and to try to do it. But then we also have a whole body of literature about organizational operations that says, even if somebody has lots of self-efficacy and they want to go use this stuff they learned, they get into environment and the bosses are like, nah, we don't try that around here. No, that's too risky. No, there's a lack of, organizational support. So it's it's difficult, for example, to make changes in organizations, but we kind of know why, and we can perhaps anticipate. So you probably heard of logic models, which are very, I think, way too basic, and I'm glad to say I think that thinking has gone beyond them. But even if you don't have the time, the energy, the resources to really spend the time with stakeholders to figure out what's the realistic theory of change in a particular context, it's at least a good starting point to figure out what are we doing and how are we going to get there to outcomes. With federal programs in a country like ours with strong states' rights and regional differences and political differences, it's pretty hard to implement programs and have everything go, the way you expected it and everybody line up to just do things. Because, for example, you may have Congress saying these are the desired outcomes, but they may not be acceptable at the local level, or they may be unrealistic. You have a lot of complexity with intergovernmental implementation. I'm a political scientist by training. I love this part. But in any case, you have networks of private and nonprofit partners. Everybody has their own, motivations and desired outcomes. You may have unexpected behavioral responses and so on. So federal programs are really interesting in a sort of in a different kind of way than if we were at much more uniform parliamentary system, for example. There's a lot of assumptions that we make about the way things are going to work that may not happen. We assume people are going to want to do what we wanted them, we expected them to do, and they may not. And one of the things the economists call the unobservables are that people, for example, that have motivations and their own personal values and assumptions that aren't going to be measurable in terms of their years of education, their gender, whatever. So there's a lot of things that we need to think about. Secondly, once you sort of think about what is it we're trying to accomplish, what are the kinds of questions we want to ask? Again, in a complex governmental system like us, you want to know, did the people even get the information? Did they understand the communications? Did they attend the training? Did those teachers take off on a Saturday unpaid to attend training on this new curriculum? All kinds of questions that we want to just describe. Did the targeted beneficiaries receive, or were they affected by what we wanted? Normative questions, did people use the money the way we thought they were going to use the money? Or, was the quality of an adequate level, and so on. Impact questions you hear a lot is, did the program work? Which is quite blunt way. There's actually a lot of other questions you may want to ask about that, but impact questions. And then exploratory, like, why is it that this is working so well in Wisconsin and we can't get it to work that way in Nebraska? What are those factors that help lead to success? So there's lots of different kinds of evaluation, all the way from needs assessment, figuring out, are we even targeting this program correctly, to all the way to the right in terms of, but did it actually work in the way it was intended? And then lastly, the point is that there's tons of different kinds of research methods that can be used. And there have been so many advances. I was in Uganda all last week at the African Evaluation Association, and it was so cool. There was so much energy from people all over the world, and particularly Africa, in the international development scene, talking about some interesting new methods to capture outcomes and unexpected outcomes and so on. And so this is just to show you that there's tons of possible designs. If you look over in the right, you can see that I have over 15 different kinds of approaches. We don't want to have sort of the law of the hammer that consultant says, well, I'm really good at surveys. Okay, well then how can we make this particular challenge into something you can answer with surveys? No. Point is, there's lots and lots of different kinds of things. So in conclusion, there's a lot of challenges we face in implementing programs, and evaluation tools and measurement strategies can help us to do a better job. But the point is to figure out matching the tool to the particular topic. And lastly, our American Evaluation Association conference is an amazing opportunity of 6 days of training, all kinds of interesting things at the Wardman Marriott up on Connecticut Avenue, November 8th to 11th. And it's a wonderful opportunity to learn. And that is actually the title. It's From Learning to Action this year. Thank you. Thank you very much. Okay.
So I would like to talk to you a little bit about performance measurement at DC Central Kitchen, where I work. And at DC Central Kitchen, we are using food as a tool to break cycles of hunger and poverty through our social ventures. And all of our work is driven by 3 main priorities: creating opportunities for meaningful careers, expanding healthy food access, and trying to provide solutions for systemic failures, whether it's economic system failures, food system failures, or legal system failures. Our portfolio includes our culinary job training program, which is what I'm going to focus on today, where we really target individuals who face significant trauma, so homelessness, addiction, incarceration, those types of things. Our community meals program, where we take donated and wasted food and transform it into nutritious meals for shelters and nonprofits in the community. Our healthy school food program, where we provide nutritious options for kids in local schools in the area. Our Healthy Corners program, where we're working to put some healthy options into food deserts, primarily in Wards 7 and 8 in the district. And then our Campus Kitchens project, where we replicate our model across the nation. So we're really interested data-wise for the culinary job training program in looking at the impact on families in poverty and then more broadly on the community. Specific questions we're asking are how we can further develop our performance measurement work so that we can properly determine how our programs are performing, but also to design strategies for program improvement. Data is really important to us at DC Central Kitchen because of our stakeholders. So if anyone knows De La Soul, I'm going to quote them: the stakes is high. We're dealing with families that are in serious crisis, and so we have to do a good job. We have to be able to design effective interventions. We have to achieve our intended impact in order for people to succeed in our programs. But we also want to tell a compelling story to our funders and investors. We do make a lot of our own money, 60% revenue, but we rely on philanthropy, we rely on grants, and so we have to be able to tell them that what we're doing works and that it's important work to do. Did anybody know that De La Soul song? No? Yeah? Okay. So some of the metrics that we look at in workforce development in the short term are the obvious ones. I think employment, initial wage, whether or not people get benefits and things like that. As time progresses, we want to look at retention and whether folks embark on a career pathway, and we're really working hard to forge a career pathway in the hospitality industry at DC Central Kitchen. And then further down the road, we really want to take a deep look at earnings over time, financial stability, housing stability, decreased reliance on food assistance programs, social services, decreased incarceration rates. And that's where we're really drilling down right now because that work is difficult. So we've partnered with a group called Economic Mobility, and they specialize in workforce development research. And so we're trying to take a look at our long-term impact. One thing that is really important to us, because we have a significant self-empowerment component to our training program, is self-efficacy and how that impacts our outcomes. Some important questions that we're asking right now. I have to actually look at this one because I can't see that. Things like, do programmatic factors such as attendance impact our outcomes? Longer term questions, do program supports that students receive impact longer term employment outcomes? So basic research questions, but again, that self-efficacy piece and how it factors into the equation is really important to us. So to conclude, I'll give you some of our outcomes, just to give you an example. So since 2014, we've trained about 192 folks. Half of these are SNAP E&T program participants. If you know about the SNAP Employment and Training Program, USD folks definitely do. We've got a pretty good starting wage for this industry, $13.16 an hour. But like I said, that's not going to be nearly enough. That's not a family-sustaining wage. And so a lot of our work is to develop talent pipelines for industries so we can provide people a career pathway and a way to move up. I think most compelling might be our data on returning citizens. So we trained about 96 returning citizens since 2014, and we have about a 6% recidivism rate compared to a national average of 68%. So a compelling story from one of our graduates, his name's Dwayne. He spent a long time in prison, a lot of time running with the gangs, And he has a daughter, and he said to me many times that he actually has broken that cycle because his daughter will eat healthy food in his neighborhood. His daughter will not be incarcerated. She will not have the same experiences that he has. And so I think it's one person at a time to tackle a big problem like this, but it's a compelling story. Some of the community impacts that we want to look at are benefits to the community. So it really costs taxpayers a lot of money to keep people in jail and to provide food assistance programs for people in the long term. And so we are really looking actively at figuring out a return on investment so that we can demonstrate our benefit to the community. So you can see some of the data points here, but every $1 that we invest in our culinary job training program brings an over $2 return on that investment. So that's some of the data that we're interested in looking at. The causes and consequences of the poverty that we're dealing with are really complex and multifaceted, as you know. And so we need to look at the problems from a lot of different angles, and that's what DC Central Kitchen endeavors to do. And data is an extremely important piece of that work. Thank you. I think that's it.
Morning, everyone. I'm going to talk about a scale that we haven't talked about much at this meeting, and that's a regional scale. This is the region for the Enhancing Food Security in the Northeast through Regional Food Systems Project, FSNE. And as you can see on the map, we have 11 institutions in our project from multiple universities, private, public. We have 2 USDA agencies engaged with us, and we have the nonprofit, the Northeast Sustainable Ag Working Group. We are working in 9 urban and rural locations around the Northeast in low-income communities in those locations with 1 or 2 supermarkets in each site. And you'll see a little bit more about supermarkets in a minute. We have about 15 different disciplines of people in the project, multiple senior researchers. At one point, we've had about 90 people working on the project. The orienting goal for us is, I'll let you read this. This is our long-term goal. I think you can say that after we're finished with 7 years, we are in our 7th year at this point on this project, that we have described, you could say we've described a lot of the baseline that we think we need to have in order to think about regionalizing more of the Northeast food system. You can also think of it, as I was hearing people yesterday, as like a planning document with all the data that we have and all the analysis and recommendations that we have, kind of a planning document for anybody who's interested in looking into the future about what the food supply might look like in the Northeast. Just really quickly, so you have some idea of what we're talking about, we have a lot of assumptions about a regional approach. Many of these have developed over many years by people who are thinking about these issues in the Northeast and in other places in the world. A larger region at a larger scale can offer, in many cases, a more ecological focus on population density, on environmental conditions, on marketing infrastructure over space and time. The Northeast has about 22% of the U.S. population. It has a very small proportion of the U.S. arable land. And so there's a good reason why we want to take a much bigger dig into what the Northeast looks like in terms of the kind of work that we're doing. Regions evolve is something that's important according to the particular issue, changed context, et cetera. The next piece of the project is that we have melded these 2 different definitions of food security. The first one is the original one from many decades ago about the region being able to produce a large quantity of its staple foods. And the second definition is what you're all familiar with, and that is community food security. So we put the 2 things together. You don't have to study this slide. It's from Polly Erickson's work in England. It's just a really good compilation of all multiple drivers and feedback loops and elements of food security anywhere in the world. We aren't addressing all of these by any means, but we're addressing quite a number of these in the project. This is a meta image of our project. I think we have something over 80 components at this point. And I'm really showing you this mainly so that you can see that what's at the center of the project as a kind of operating principle or an operationalization element is our market basket of foods. We chose 8 foods, a mix of foods that are grown in some prominence in the Northeast and some other foods that aren't, that would be found in many low-income households' shopping carts. And that each team, we have 8 or 9 teams in the project, including production, consumption, and distribution, and each team has used a market basket to look at, through various disciplinary lenses, various kinds of things, and I don't have time to tell you about anything. Since this is an evaluation, session, I did want to bring this up to people who might be involved or could in the future be involved in interdisciplinary projects. They need to be evaluated very differently than a lot of other projects. And here's just a few of the issues that we see. Many of the outputs of these kinds of systems, interdisciplinary projects, long-term are going to be methods, protocols, models, case studies, baseline measures. They don't get evaluated the same way as kind of straight-line interventions. The metrics are very different even in a single discipline, and when you put 15 different disciplines together, to get a really rich story about what's going on, you have to make a case for that as well in terms of evaluation. Many of the outcomes are long-term in these kinds of projects. We're not an intervention project. We're really gathering all kinds of information to help move us into the future. And we need to translate research findings into briefs, which we are doing with all of our findings. So just really quickly here at the end, some of the findings that we have from the project at this point that we thought you might be interested in is we have models that tell us the capacity to enhance production and improve supply chains in the future. We have models for potatoes, broccoli, cabbage, wheat, milk, and apples. Several of those models include climate change components, which we think are very important for everybody to be looking at as we go into the future. We have regional value added percentages that go down the supply chain. And what's important about that is that we are seeing that by only looking at the return, the economic return from production in the region, we're missing an enormous amount of economic return that is occurring through wholesaling and retailing and brokering and all that other kind of stuff. We have one finding that we're going to spend a lot more time looking at, and that's the vulnerability of smaller supermarkets in low-income areas and how fragile they are, and we don't think people are paying quite enough attention to these smaller supermarkets. And we also have some unique maps that show the urban, peri-urban, and rural locations of all the food supply members across multiple areas in the Northeast. So here's the final. Sorry, it took a little extra time. It does have 80 components. There's our website, and this was a food security grant from the Global Food Security Program at USDA AFRI-NIFA, and we thank them very much.
Okay, I'm just waiting for
Slides to come up.
slides show up. My timer's going, but the slide's not there yet.
Push it one more time.
Maybe push it. Okay. Oh,
Oh, no.
okay. There we go. Thank you. So, again, I'm Rich Pirog. I'm the Director of Center for Regional Food Systems at Michigan State, and I want to share our Michigan story of using a shared measurement initiative to help assess the progress we've made on the goals of the Michigan Good Food Charter. A number of states have charters. I know Minnesota folks are here. I think several other states that have some form of a state charter around local and good food. The Michigan Charter, which was started in 2010, has 6 goals, 25 agenda priorities. It is the policy framework for good food in the state of Michigan. When we talk about good, we talk about food that's affordable, fair, green, and healthy. And again, I'm not going to go into definitions because of the limited amount of time. We have many organizations and businesses that have signed on to the charter. We have 17 different organizations that are on the steering committee that meets 4 to 5 times a year, that works with our staff. And they're across the state looking at how we can move the progress on the Good Food Charter goals forward. One of the reasons why we went with shared measurement, I think some folks in the audience are familiar with the concept of collective impact. I am not going to give a primer on collective impact other than to say that the charter itself, the idea of good food for all Michiganders, healthy, affordable, creating jobs, is a wicked challenge. It's a difficult challenge. It's going to take a very strong and dedicated public-private partnership. And so the 5 conditions that we see in collective impact, and we've just written, one of my staff colleagues and I have just co-authored a paper with our evaluator about some of the pros and cons of collective impact. I'm not going to go into that here, but we've seen some of those. But those 5 conditions in collective impact for public-private partnerships: common agenda, shared measurement, which we'll get back to, mutually reinforcing activities, continuous communication, and a backbone organization, at least one organization responsible for the collaboration infrastructure for that public-private partnership is really critical. So we did decide shortly after we said we would embrace the collective impact framework to start a shared measurement initiative. I want to give a shout out. We started in late 2014, so we've been at this 2.5 years. Want to give a shout out to one of my staff, Catherine Colasante. She's in the audience. Catherine's been the lead on this, along with our research partner, Gretchen Swanson, Center for Nutrition. Where we started, we worked with all the partners and we did formative research, and we found out where they were when it came to the idea of being able to work collectively on a shared measurement project. And we found that it was really clear that there wasn't the kind of capacity there needed to be around data management, around data collection, understanding what would make good metrics. And so rather than plunging ahead and working on collecting data, we took a step back and we worked for a while. We did a number of training webinars that Catherine and a number of her partners worked on to address some of the things that was really clear in the formative research that we needed a lot of help with. We also and these were all sort of done in overlapping phases, we also identified 3 priority areas that came out of the 6 goals of the charter. The charter is like any charter in any state. A lot of it's about healthy food access, about economic goals, education goals. We chose 3 particular, these show up in blue here, but not my slides. That's nice. The first of these 3 is institutional procurement. And I want to give a shout out to another staff member here, Colleen Matz on our staff. Colleen runs the Michigan Farm Institution Network. We have a whole series of state-level networks that we act as a backbone organization trying to provide collaboration infrastructure across a number of things: food hubs, local food councils, farm institution, meat value chains. And Cultivate Michigan, Colleen and her partners, a nonprofit partner in Extension, I think there's 60 different institutions that we have really high-level procurement data that we're collecting around Michigan foods. Okay, moving on to the second one on economic impacts. Michigan was one of the first states to work with Dawn and Becca, who are in the audience here, with the USDA URS-funded Local Food Economic Impact Toolkit. We had 25 different organizations that we were able to bring together by invite. That's the way to get people to show up if you really want to get a composite of what you have in the state. We did a full-day training there. We're working, Catherine and another colleague are working on pro and con of a whole set of economic impact tools that we can use in Michigan, because we found that in-plan, for example, is very valuable, but not everybody is really set up and is in the best space to use in-plan. The third thing is around food access, and that's what I'll spend the rest of my brief time on, and I mean brief. We worked at a pilot in 3 different cities, collected data. Because we're using shared measurement, we were able to collect data, not only empower them to collect the data, but they learned from each other. They used shared methodology, so Ypsilanti, Pontiac, Battle Creek all collected data. They have their own data sets, they have their own reports, we have an aggregated set of reports, and then the third exciting part of this is that we have a story of how they work together. And all 3 parts of that, I think, are part of that future story. So next steps, and I'm gonna just whip through this. Big lesson, creating capacity for and a culture of shared measurement. I mean, we want to do this in 25, 30, 40 cities in Michigan. We want this to be the norm of how we do things. This takes a heck of a lot of time and it takes resources. Kellogg Foundation funds some of this. You got to get people on the same page or meet with them where they are. So understanding what their needs are first before you start collecting data is critical. We're going to continue to analyze this data, and we hope to pilot, go to rural communities in 17. If we get more resources, we're going to do more cities and communities in 18, and we want to work with the other states that are doing shared measurement. And not only do we feel we can help achieve the goals or help assess whether we're achieving the goals of the charter, we will build up that culture of shared measurement, sort of doing our own statewide shared measurement conference. And data is power, folks. Data is, if we can get our community partners so they can really both collect and manage data rather than just academics and government folks doing it, I think we really have a better, much better shot at being able to inform and influence state policy. Thank you. So I am sort of the ad hoc impromptu moderator here, and so we're waiting for Pigeonhole to appear.
There it is.
And so I will field some of these questions, and we'll go back and forth. And I'm going to go with the most popular question first because I want to keep things going. There it is. Impact evaluations are often constrained by small sample sizes. How much does the local food sector lend itself to this constraint? How can this obstacle be addressed? And then again, just for the folks in the audience, we have Kathy on my far side, Kim and Kate. Anybody want to take a stab at that question?
It depends upon what the sample is. Is it 5 people? Is it 5 farms? Is it 5 cities? So that's why I'm not sure how to answer that. It seems to me that it also depends upon what the kinds of questions you have are. So you wouldn't use 5 people who had been in your training program, but you might use 5 training programs that each had 17 in them to average across them. So I'm not sure exactly how to address that. If you see what I mean, it depends upon what the units are in the sample. Obviously not 5 people. And you also, what's even more important is how you got the sample. So if it was a focus group, we know that those, or a survey, or interviews, people are going to volunteer, and they might be systematically different if they volunteer to participate than the people that you don't have in the room or you aren't talking to. So it's not just sample size, guys. It's, are we concerned whether or not the sample is representative of the people to which you want, or the farms or whatever that you want to generalize to.
And I just add, like, we have a fairly small sample of stores across the Northeast, but the case studies that we're doing on the stores are so in-depth that our 11 or 12 stores give us a lot of information. We're not trying to suggest that it represents the whole Northeast at all, but we have a ton of information from those 12 really in-depth case studies.
Could I just tag on? I think that's an excellent example that when you have extensive case studies, then you have much more qualitative data collection. You're able to come up with insights that may be transferable. They aren't like, I'm 95% confident that 300 other stores would be like this, but they would be transferable, perhaps promising practices. And so that's an excellent way to get insights.
Okay, Kim, I'm going to go to you here. How is DC Central Kitchen linking local farms to urban people, and how do you measure it?
Yeah, so one of our, I think, most difficult programs to measure is our Healthy Corners program, where we take local food and try to use our graduates of our training program in processing that food and get it to a lot of different corner stores in Ward 7 and 8. And right now we measure the impact as best we can by sales, essentially how much the stores purchase from us, how much they sell, how much they waste, how much doesn't sell in their store. But it really doesn't get us the answers that we want all the way. It's a difficult program for us to assess. I probably need to call you to help us with that evaluation. But one thing I'm really, really interested in with that program in particular is generating demand from the communities that we are trying to help. And there's a lot of good research in the international development space where we can't tell people what they need and what they should do. We need people to demand what they should have. And when it comes to nutritious food, we have not been able to generate enough demand, as far as I'm concerned, so that people will go to those corner stores and insist through buying stuff and using their SNAP dollars to purchase fresh and healthy foods. We haven't generated enough demand there to get the stores to want to buy more food from us. But that's the work that we're doing. So, yeah, go ahead.
A real quick suggestion, and you can probably say, yeah, Kathy, I know. But have you worked through community-based organizations or churches to get the word out?
Yeah, and that's a good point. What we're working on now is a community liaison program. One of the I think most interesting parts of DC Central Kitchen is the fact that a lot of our business is run by our graduates. So we want to be a good employer and also a good training program. So of our 170 or so staff, nearly 80 of those are graduates of our training program. So a lot of them work in food service, but we want to expand the number of jobs that we have for those folks, and we think community liaisons could be the answer, reaching out to community organizations that actually have more buy-in in the community than some of us do. And I think that's going to be an important way to flip it from us just providing access to really generating demand in those communities.
Okay. I'm going to take this one for obvious reasons. Are the Michigan training webinars available for use? Answer is yes, and you could talk to either Catherine Colasanti or myself. They're on the Center for Regional Food Systems website. So the answer for the most part is yes. Catherine will give me hell if I'm wrong with that answer later. The most popular question, if there was one book to read on evaluation methodology, what would you read? I'm going to start with you, Kathy.
Well, I would say the Catherine Newcomer book.
Why would you? Surprise.
It's been called Shameless Self-Promotion.
That's a shameless self-promotion.
Yesterday.
I didn't think you, anyway, it's called the Handbook of Practical Program Evaluation, and it's called practical because it's for people that are actually practicing stuff, not just for academics. And it's under Newcomer, Hattrey, and Holy, the Handbook of Practical Program Evaluation. But if you wanted something shorter, because it's kind of long, but the point is it has different things, different kinds of chapters on very specific things, like telling stories in evaluation, for example, because that, there's a whole chapter on that, and then recruiting people to be in studies. So so anyway, I'll think about that.
Okay.
Carol Weiss has a good book, but the really good one was in like '78, and it's hard to find. But it was really, I call it like an automobile manual. It's really short. Carol Weiss, W-E-I-S-S. I love that book, if you can find it.
Okay. Kim or Kate, any other books?
No.
I have the
Okay.
same suggestions, exactly.
Okay. There we go. We're unified on this.
We're
panel.
friends.
Yeah, there you go. A new question for everybody. How do local food evaluation methods differ in rural versus urban spaces?
I can't take that
Yeah,
one.
she does know.
Do you want to take a crack at that?
They differ a lot. First of all, they differ in content. And that's something that people also would add to your list of what you evaluate is you really do have to, you think about the content of what you want to ask questions about. And then you have to, and we learned some of this post hoc, not before, with our rural areas, that they are very different in very specific ways with regard to how supply chains operate, for example. Or, of course, we knew how people shop, or, and what the distances were and all those kinds of things. We also found that the kinds of issues that people have in rural areas, we did tons of focus groups in all the low-income communities at the beginning and at the middle, and we found that there are nuances of food system questions and food access and other things that are also very different in rural areas than they are in urban areas. I mean, kind of by definition. But I don't think you learn this until you get into a rural area and start really questioning a lot of people about what they need to know. And so it would be better to know that at the beginning of your project is what I'm saying. And we worked with site leaders in all of our communities, including in some of the rural communities, but they were learning along with us about some of these questions.
I'll just say we hope to learn more as we move in shared measurement and with a focus on rural communities this year after being in 3 very urban centers in southern Michigan. We're going to go to another question here. can the metrics be the same across cultures, or are there different sensitivities and perspectives that need to be built in?
So we have actually a really good chapter about culturally responsive evaluation in the book. I really didn't come here to, I don't really, but anyway, the point is, that's a huge thing in our, I was in Uganda all last week at an African Evaluation Association, and there's a big movement to call it Made in Africa Evaluation. Because the point is, of course, you have to contextualize and be concerned about culturally appropriate methods, whether you're in Uganda or in downtown DC. And so literally, yes, there's a lot of concern about, if you think about, for example, in very international cities, like you would find in Michigan or DC, people speak different language, they have different kinds of norms about even asking questions, and so it's a really big thing, and there's you need to really be very careful about that in terms of thinking about data collection. Who are the data collectors? How do you ask the questions? So yes, that's a huge thing. We call it cultural humility. I mean, I call it, and a lot of other people do, because we don't even know what we don't know. And that's what I mean about humility, is you don't even know what you don't know when you go out to deal with people from other cultures. And so there's unfortunately, there's not like a checklist I can give you and you can go, whoop, I'm culturally competent. Doesn't work that way. No.
Well, we're getting the flashing light, so I think we're done. But the question, will the slides presented be available for conference attendees? We would.
I don't know.
Yeah.
The panels, our panel says yeah, so I think they.
Fine with me.
Fine with us. So let's give our panel a hand.
Thank you.